Well, the microbial world that surrounds us undergoes changes, and these changes are particularly relevant and potentially dangerous in wildlife in regions like Africa. So it's inevitable. We do have periodic infections in humans coming from wildlife. For instance, the Lassa fever. It's again an hemorrhagic fever, and every year it appears in certain regions of Africa. So we should be prepared to tackle new infectious agents coming from wildlife and from mutations of existing microbes. We should not panic. There is no reason to be worried, to panic in the Western world, because the disease is a rapidly lethal disease which is confined to specific areas of Africa. So there is no reason to panic and to run to the emergency care for minor illness. Don't relax. There is no reason to do prevention because we do not have the problem at home. But there is a good reason. The best way to do prevention is to address the epidemic in Africa. And this means strengthening the health system in those African countries and developing as fast as possible a vaccine. This is the real prevention. In terms of us as people living in the Western world, what we can do is what we should always do: keep our immune system in good shape, with no smoking, with healthy diet, with vegetables, or raw vegetables or fruit 5 times a day, and physical exercise every day. Flu symptoms initially can be similar. In other words, high fever, a sense of drowsiness, the aches, muscle aches, but we should not, again, once more I say, we should not run to the emergency hospital when we have symptoms like this, unless we are coming back from a trip in one of the countries at risk, unless we have had contacts with people coming back from countries at risk. If we rush to the hospitals because of these minor symptoms, then we are doing harm to ourselves and to our community.